guys, Lauren and Rebecca here with Bizrok. In this week's video, we're going to talk to you about best practices when it comes to nitrous. Now, this is one of those where I feel like we could swap a lot of stories on what not to do in the practice, and I do want to address some of those because we see it all the time, guys. But can you share with us, maybe some protocols or processes for how to handle nitrous in the practice and things not to do?
Yes. So start off with nitrous. Every state is different. So some states, the assistant is able to start administering nitrous, and some states the doctor actually has to be the one to start administering it. So depending on what state you're in, do what is within your legal limits, please.
And certification. There's a lot of different certifications
too,
right?
There is. So if you are legally allowed to start, whether it's the doctor or a team member, go ahead and get the patient started on nitrous. Start off low and work your way up to the amount that you want to administer to the patient. Once the nitrous is on, though, and you have swapped from just oxygen to adding some nitrous, the number one thing you cannot do is walk out of the room. So you can never leave your patient. As soon as that nitrous is on, you are glued to that room. If for some reason you need to leave, that's okay, because we have radio communication and we're using whatever internal communication system that we utilize. Hopefully, again, it's the radios.
I was going to say, this is, again, why radios are so beneficial. And I know we've talked about that, guys, but I feel like it comes up so often in some of the things that we teach because it makes sense, right?
So much easier. For myself, it's easier to continuously watch my patients. If I wheel my chair back and I am face-to-face with the patient while they're on nitrous, I don't have to get behind them to type in something on a keyboard. I can just radio by pressing a button that I need assistant in operatory 2, and somebody will come in there and see what's going on. And then at that time, I will ask somebody to either stay in there with the patient because I need to grab something or use the restroom quickly.
Yes.
But I am not going to leave that patient alone. And that also includes stepping into the hallway to find somebody to come relieve you. So you have to use an internal communication system of some sort to be able to get the assistance you need.
Well, and that's why the morning huddle, that has to start your day, guys. It's so important. So important. Because it allows you to say, hey, guys, friendly reminder from, 11 to 2:30, I'll have a patient. I'll probably need a restroom break at some point during the day. So please listen for me to say assistance needed in my operatory so that you can help and come in there, right?
Yes, absolutely. And I always suggest on larger surgical cases, if you can have 2 assistants in the room at all times, that is going to be the best outcome. But if you're unable to, just use that internal communication, use your morning huddle, let the team know that you will need somebody to check on you periodically, and hopefully they don't forget about you and they keep coming back and checking on you. But once your patient is on nitrous, again, just not leaving them alone. The next thing you have to do is keep your eye on your gauges. Guys, a lot of times we call what I call the pizza pie, the assistant table you put over the nitrous machine, or it's built into the 12 o'clock unit, which is fine, but making sure we have a door open and or your assistant table move to the side so that way you can see the gauges, and you're checking them every 30 seconds to a minute to make sure the gauges aren't fluctuating and getting to a number that we need to be aware of to change tanks or turn one off and turn a new one on, just to make sure that the patient is okay at all times.
Which is really tough to do and check it that many times if you're out of the room, right?
Yes, absolutely. And also, as an assistant, you've got to learn how to multitask. So you're not only just helping the doctor and assisting the doctor, keep an eye so that you can kind of keep glancing down at that throughout, and you're able to take some recorded pressures. So if you have a pulse ox on the patient, keep that recorded. Same thing as the blood pressure prior to treatment and blood pressure to after treatment.
Very good. As we wrap up this video, Rebecca, do you mind touching on notating and what things should be notated and where that should go?
So at the beginning, you always want to notate who administered, who started the nitrous on the patient, the percentage of the nitrous that they were on, and the percentage of oxygen, how long they were on that, and then at the very end, they need to be on 100% oxygen for 5 to 10 minutes. And that is important so they don't get a nitrous headache.
Yes.
Those are real, and they're very uncomfortable for a patient. A lot of patients think when they leave the office after nitrous that they're not going to be able to drive and or walk. They absolutely can. The only side effect for nitrous is it can give you a headache if you don't flush it out of your system properly and you do it too quickly. So for instance, the patient needs to go to the restroom. That is perfectly fine. But we do need to stop. We do need to allow them to breathe 100% oxygen for 5 to 10 minutes, and then they can get up and use the restroom. If not, they will get a nitrous headache, and I have been told those do not feel very great. Notate that.
I was going to say, which is why it's so important to communicate to your patient, and that's where the front office team should come into play, right? So whenever they're checking their patient in, hey, we're going to take great care of you today. Real quick, I do know that it's going to be really tough to pause in the middle of this appointment to allow you to use the restroom. If you have to go, I'd go ahead and do that, or at least try before your assistant comes to take you to the back, right?
And then after you grab the patient, ask them again, if you're passing the restroom, I would go ahead and point it out and say, the restroom's right here. Would you like to use the restroom before we go back into your operatory?
Yes. I mean, it just allows for efficiency because, you know, getting them to switch over to oxygen for 5 to 10 minutes in the middle of the appointment, I mean, that could really slow you down and ruin the whole day, right?
It can. It can start leaving you behind because not only do you have to take them off, but then you've got to get them back on.
Yes.
And get them comfortable. And some patients, it's a little bit harder, especially once they get up and moving. Their anxiety starts to kick back in and they are able to lower their heart rate to actually relax enough to absorb the nitrous.
And we've seen that where the patient gets up, they go to the restroom, and then like just like you said, anxiety kicks in and you can't finish the appointment sometimes because it's like, okay, now we need to restructure how we're taking care of this patient.
Absolutely.
They might need to have some Valium or something else. And so it's just best practice to offer the restroom at check-in, but then again, as you're passing the restroom. So I love that. Yes. Last thing, Rebecca, I know we talked about notating and where we're documenting it. Sometimes we always get the question in the office, so am I really pausing throughout the appointment multiple times and I'm typing it into their notes? Can you give some guidance around that?
Yes, so I always keep a pen, a sterilized pen on my assistant table or the pizza pie, and then just write it down on your tray sheet. So just write down the time is on your computer and or look at your watch really quick, write down the time and write down your stats really quick. And if they are hooked up to a machine that's doing it for you, you just print out your label and you scan that in.
So
as long as it's in their chart.
Yes.
You just have to have it notated somewhere in the chart. And if it is scanned in, just on your patient notes for that day, please put C-scan documents and then they know to go there to look for it.
Awesome. Well, guys, if you need any help, please reach out to us. As always, we're here to help you guys, support you. Otherwise, as always, we can't wait to see you and serve you soon.